What we want the Early Health Index to be is a real-world, usable tool that helps define what health policy experts and individuals and countries and donors and economists need to do. Not what they need to think about, but what they need to do. And we really want this to be an interactive session that says, how do we create this tool?
Everybody understands what early health actually is and what their priorities in early health are slightly differently. So it will be quite difficult to come up with the one big index, which is true for all. However, everybody got quite inspired about the idea, and I think if there was one unified message or one unified learning from these conversations, it was the idea of measuring the early health of nations across disease states was an idea which resonated well.
I think the four dimensions of infrastructure, interventions, outcomes, and risk factors is fine with me. I covered most of the major categories. The only thing is that for risk factors, perhaps due to the advancement of technology, it will change for some time. For example, maybe we find, in particular, using the cutting edge of genomic sciences to define that to further more detailed and more specific risk factors.
Here you identify 10 variables as actionable, but I would see a much more augmented, much richer menu of variables.
One of my most difficult lessons as an epidemiologist is the worst person to think about what the right categories are is the epidemiologist or the scientist. What you really have to do is to ask the policymaker, the user, the target audience, what information is going to be most useful for you and how do you want that arrayed so it will be most helpful. And so as we go through this is a good start, but we need to be prepared to change. I would say that as you look within developing countries, into middle-income countries, and then in the industrialized world, these categories might be right, but what the policymaker, as far as individual variables, is actually going to want to see is going to be widely different depending on where you're sitting. And so we may need to be thinking about a health index that has a small number of core variables, but then a fair amount of room for customization at the country level.
For me, in trying to decide how we should deliver public health in the future and health policy, I need those different divisions. I want to look at what screening we do. Do we do human papillomavirus screening? Or that's a health system issue. Do we provide it? Then there's a personal issue. What's the uptake? Quite apart from the outcomes. And I need to tease those out separately to decide what to do.
The quantification is a critical element here. So use of a tool that's practical and that can provide you some estimate of the opportunity to improve with a particular investment will enable policymakers to apply their social values and then make resource allocation decisions.
Decision makers that, particularly in governments, need to be sure that what we're trying to sell is very specific, it's very clear, that the deliverables are very manageable, because if they're not, then it becomes very muddied and no one's really clearly defined where we are. The timetables have to be short. If you're trying to sell something 15 years down the road, most policymakers are going to be sitting there saying 15 years down the road, they're going to be doing something else, or they're going to say too many other variables will have come into play that will change the course of things, and the dollars will be allocated to something else. And then I think the most important thing also is how do you make this cost efficient? Because as was mentioned earlier, a dollar that's spent here is not spent somewhere else.
In the survey that was presented at the beginning, I guess of the respondents who responded, 73% saw early health strategy as important, 76% believe that early health funding should be increased, but as the point was just made, funding is an investment decision, and clearly, from a health economics point of view, we need to make sure that that funding is well spent in terms of its impact.